Okay, Pahrump, thank you for tuning in tonight. Welcome back from the break. And again, our phone number for a dial-in for any questions is 727-8750. That's 727-8750. And again, I'm Dr. Michael Reiner, your host of this show, The Independent Doctors of Pahrump. And we were on the first half of the show talking a lot about this change in scheduling of hydrocodone to Schedule 2 from a Schedule 3. And one of the things the state board, I did call the State Board of Pharmacy, and that the DEA does not limit the numbers that you can write. So theoretically, I could write you 3 months. I could write you any number amount. But then again, the pharmacies are not filling those. They say that you can write a prescription for, and one of the pharmacists was telling some of the patients this, that, yeah, the doctor can see you on, let's say, January 1, and then can write you 2 prescriptions, one for do not fill before February 1 and do not fill before March 1. And that would be as so long as the date do not fill before is not 90 days greater than the date at which it was written. So that means I could not write do not fill before April 1 because that would exceed the 90 days from January 1. Again, the issue is that why did they change that rule? Why have they allowed that? Prior to that, Schedule 2 drugs were had to be seen and could not be refilled. So there is a little quirk in the law that does allow for that. But we as individual practitioners ultimately have the final say-so in how we choose to write or dispense these medications. So with the specter of drug abuse being out there and writing these so-called refills or these prescriptions that you give to the pharmacy, it's almost like an entrapment situation. I mean, they are dangerous drugs, and people do need to be evaluated for their pain, and they do need to be seen. They need to make sure that their pain medications are working for them and they're not having any other issues. And it is true that people that take opioids for a long period of time are very stable and can do a lot of things that people who get drunk could not do. There have been multiple studies that show that. So it's always a give and a take. It's always the risk-benefit ratio. And that's what we as physicians or practitioners are always evaluating. If you're too cavalier in giving somebody too many prescriptions and not checking up on them, you're going to have a overdose problem or possibly an abuse problem. If you're too tight, people may not like having to come to the office all the time to wait. But until this stuff gets sorted out, and it may take a year or so, I encourage patients to complain a little bit to your government officials. I certainly would employ that you trade with your pharmacies that give you the respect that you are due as your patient and not treat you as a drug abuser. And there are some pharmacies out there that are more prone to do that than other ones. I would stay clear of them. That's not a place I would want to be to prejudged on whether or not my prescription, if I'm an addict or not. Most people that are going to the pharmacy to get their pills are not addicts. They're buying them on the street, and they're not involved in going and presenting themselves in a manner in which they do business. So that's about all I really want to say about that tonight. I do want to talk a little bit about one of the things along addiction lines, which is smoking. Smoking is one of those things that's been around for years. Tobacco has been a part of our lives as long as I can remember. It's probably as long as you can remember. Coming out of the war, World War II, everybody smoked, it seemed like. I remember growing up, both of my parents smoked. If you didn't have a cigarette in your mouth, it was almost like there was something wrong with you. And that's why we're seeing so much COPD and other related diseases today. The government has done everything they can do to try and make smoking less of a problem or less palatable for people. They've outlawed it in restaurants. They've outlawed it in just about every public gathering place, certainly on an airplane, certainly one harrowing story. I think it was back in the 80s, I flew out to Las Vegas, and the I was flying back to Houston, and this lady had some respiratory difficulties on the plane, and back then everybody lit up, and the plane becomes full of smoke, and the lady couldn't breathe, and they dropped the plane down to a lower altitude. The oxygen mask dropped down for this lady, and the people behind me were getting drunk, and I was just sure with oxygen on a plane they were going to light up their lighter, and the next thing you know, the plane was going to blow up. So it was one of those things that it scares the living daylights out of you. But how far have we come since that time? But despite all of that, smoking is still a major, major issue in our society. Those people, it's an incredible, and there's a difference between addiction and dependency. As again I said, addiction is defined as doing something despite the negative consequence. So smoking has both a dependency and an addiction. We know it's not good for your health. We know it costs you money. We know it makes your life unmanageable, but yet you continue to do it. So therefore, it is defined as an addiction to nicotine. But there's two parts to smoking addiction. There's the nicotine, which is the chemical addiction, and then there's the ritual addiction of actually doing the activity, of lighting up the cigarette. There's certain associations that we have with that behavior. If we eat, we want to have a cigarette. If we are involved in a lengthy phone conversation with somebody, we'll want to light up a cigarette. So there's a lot of situational issues that happen with cigarette smoking that that don't go away when you decide, or you make the opportunity, or you decide to quit. The physical addiction, nicotine as a drug. They did a study with monkeys, and they gave monkeys all the addictive substances known to man. And the two substances that were uniformly as addictive were cocaine and nicotine. The monkeys uniformly died they could dose themselves, they could hit a lever and dose themselves. So all the monkeys on cocaine died because they felt euphoric up until the point that they went into some kind of cardiac arrest. But the monkeys on nicotine got sick before they died. But the amount of which they hit the lever was basically the same for those two products. With that being said, if you smoke a pack a day, that's about 360,000 doses of nicotine in a year's period of time. That's a lot of nicotine. That's a lot of tolerance. That's the same as 300,000 drinks of alcohol. Nobody could possibly do that. 300,000 lines of cocaine, if that's what you happen to do, or pills. Nobody ever develops that tolerance. But that's what the nicotine, every time you take a dose of nicotine, you're getting a dose of that particular drug. So that's an incredible tolerance. And that tolerance causes a withdrawal when you stop smoking. And there are certain receptors that are stimulated when nicotine hits that, one of them being dopamine, which is part of the pleasure symptoms, which probably lies with cocaine, because that's exactly what cocaine does. It stimulates dopamine and other neurotransmitters. And when you withdraw, you get that out of it. So your nicotine is really out of your system in 72 hours. So if you quit smoking within 72 hours, the nicotine is out of your system. And the withdrawal effects are really not as severe as withdrawing from opioids, which would cause diarrhea and palpitations and things of that nature. But withdrawing from opioids could be a life-threatening situation. Withdrawing from alcohol could be a life-threatening situation. Withdrawing from nicotine is never a life-threatening situation. Nobody has ever died from withdrawal of nicotine. And so you need to keep that in mind. Yeah, you may get irritable, and yes, you may have a runny nose, or you may have some other issues, but it's very short-lived. So why do people have such a hard time quitting smoking? So if the nicotine's out of their system in 72 hours, what's the rub? Well, the rub is that we're talking about this psychological addiction that takes place, this ritual of what smoking does for you, and how it's really a blocker. It's really something you put in between you and your feelings and emotions. And why do people gain weight when they quit smoking? Well, instead of doing this, they're doing this. They're eating. And this is a physical stuffing of your feelings and emotions. And if you're doing that, then you're not really take into account, how do I feel, how am I in this moment, and what am I dealing with? And when you're concentrating on smoking, if you take a cigarette break, you're out relaxing, you're out. I don't know how many people drive by the on Calvada, and it seems like our state welfare department is all out every 15 minutes having a cigarette. I mean, it's pretty amazing, but you know, that's the, but it is, it's one of those powerful psychological addictions. So how do you break that? I mean, what mind game do you have to play with yourself? And the way you do that is you promise yourself, and people that have gone through different programs like AA and NA, I can do for 5 minutes that would for a lifetime be impossible. Meaning I can quit for 5 minutes, but I only have to quit for a 5-minute interval. I don't have to quit for a lifetime. And this is a mind game that you play with yourself. And what some people do, they talk about, you know, the clock. You know, we'll watch the clock. I mean, I'll only have a cigarette on every 5-minute intervals. And you will be surprised if you tell yourself no once. I mean, then you have a decent chance of beating that psychological association, meaning it's subconscious. I get in this situation and I want a cigarette. I get in this situation and I'm looking for a cigarette. And you never have the ability to tell yourself no. People who smoke have their cigarettes right here with them. They're right here, they're right in their pocket. I mean, you won't leave home without your cigarettes, but you might leave home without your phone. And you might leave home without your wallet. But you, as a smoker, will never leave without your cigarettes. And that's just how important that is. So we're going to be going to break and in just a few minutes. So when we come back, we'll talk a little bit maybe about some of the therapeutic options and a little bit more about smoking addiction. So it is very important to realize that this is not an impossible task. This is not the end of the world to quit smoking. You just have to have a mindset that's a little bit stronger than the addiction itself. And you have to realize where the traps are. You have to really plan to quit smoking. You have to make that date. You have to get rid of the cigarettes out of your house. And certainly if you have a loved one that smokes with you, then it's going to be even more difficult to quit smoking. So with that, we're going to be going to break. And when we come back, I just want you to, I'll give you a few simple secrets to quitting smoking. You know, I was an ex-smoker and I quit. And I quit about 30 years ago. So we'll be right back. Thank you very much for tuning in tonight.